Good morning, everyone. Welcome to Health and Human Services on this Thursday, January 30th. We've got 3 items on our agenda this morning, some reports from the department that we would like to go over and have conversations on along with their presentations. So the first one, I'd like to welcome to the testifier station. We'll let you finish your conversation, but we'll welcome to our committee. If please come up and join us, Commissioner Brown. This is they'll have a slide presentation and report on the Department of Children, Youth, and Families. So welcome to the committee this morning. Please identify yourself for the record and continue on with your presentation. So welcome.
All right. Good morning, Chair Utke, Chair Wickland, and members of the committee. I'm Tiki Brown, the Commissioner for the Department of Children, Youth, and Families. Thank you for having us today. All right. So we'll start off with our slide deck here. The Governor Walz and Lieutenant Governor Flanagan 2025 budget protects the progress made by pairing thoughtful reductions with small and impactful investments. The budget for the Department of Children, Youth, and Families, or DCYF, includes 2 saving proposals and does not include cuts to critical social safety net programs. The budget maintains progress made over the past few years to strengthen families, provide economic stability for Minnesotans receiving cash assistance during a crisis, and prevents unnecessary foster care placements of children away from their homes and communities. The budget also makes important investments in preventing fraud, waste, and abuse, and moving towards compliance with federal child care regulations, and dedicates existing IT resources to child welfare SSIS modernization. On our next slide here, it provides an overview of how the governor's budget leverages federal resources, makes targeted reductions, and adds modest general fund investments. And for our child welfare SSIS modernization proposal, dedicates existing funding to address current challenges. Overall, our budget provides a net savings to the general fund. On slide 4 here are 2025 investments. Show our budget for DCYF invests or dedicates funding to support program integrity enhancements, modernization of our child welfare IT system, meeting federal requirements for the Child Care Assistance Program, or CCAP, helps to ensure the agency has adequate operational resources, and ensures DCYF is able to manage the agency's transition account. A note about the formatting for the PowerPoint deck over the next several slides. We have written the cost on the left side and added a box on the top left in green, noting the page in the biennial budget book for your reference. All right, so we're on slide 5, enhancing program integrity. This recommendation invests $5.4 million in fiscal year 26 and 27, and $2.8 million in fiscal year 28 and 29 to enhance program integrity at DCYF. This includes a $4.9 million investment in 26 and 27 and $2.2 million in 28 and 29 for the implementation of a statewide electronic attendance record-keeping system for the Child Care Assistance Program. This is not only necessary infrastructure needed to implement other changes required by a new federal rule, but it also supports program integrity and fraud prevention in CCAP. Once complete, the system would provide the state with data on attendance in programs in a consistent and timely manner. The current practice is often manual, it varies by local agency, and subsequently comes with a delay when it is needed. This would provide a standard across all agencies. Something similar is currently in progress with the Early Learning Scholarships, so this further aligns the programs under the goal of the Great Start Scholarship Program by establishing one method of attendance tracking for providers regardless of the program. This recommendation also includes 2 FTEs in the DCYF Compliance Office to enhance the agency's internal process controls, grant monitoring, and data analytics to improve oversight of public programs. These positions will expand the agency's capacity to effectively monitor providers and other entities receiving public funding, preventing negative audit findings, and ensure that DCYF meets its statutory obligations to remove bad actors from public programs when program integrity violations occur. Slide 6 is our child welfare IT modernization. The Social Service Information System, or SSIS, is a state's case management and reporting system. County and tribal social services use SSIS to track, manage, and pay for social services. SSIS is used to report to the federal government on child welfare activities such as child maltreatment reports, out-of-home placement for children, and adoption kinship care for children. The program was developed in the 1990s, over 30 years ago, and has more than 10,000 users. There is an urgent need for modernization of the system due to frequent outages, slow performance, and a lack of usability. This recommendation dedicates $10 million of a 2023 appropriation, creating an IT innovation fund to child welfare SSIS modernization. One area of SSIS that will be improved by modernization is our state's ability to track emergency holds by law enforcement. This is one of the recommendations provided by the Office of Legislative Auditor in their 2022-2024 report. On slide 7 is our CCAP, or Child Care Assistance Program, federal compliance. There are a number of changes that need to be made to the Child Care Assistance Program, or CCAP, in order to reach federal compliance. These are a result of federal partners in the Office of Child Care identifying updates that are needed to meet current regulations, as well as responding and planning for a new rule that went into effect last spring. The components of this proposal not only put us on a path to achieve full federal compliance, but are also positive for families. They include capping family co-pays at 7% of a family's income, down from the current 14%. In addition to reducing families' co-payment, the new tier restructuring would be easier to administer and less burdensome on both families and providers due to fewer tiers and an eliminated $2 copay. It would also include making redetermination dates consistently 12 months from the date of the last determination. This makes the process easier for families and for local agencies administering CCAP. Achieving this includes 2 underlying changes. One, to reset the family's redetermination period when a child is added, and a new determination period is essentially done. And another, to eliminate requirements for certain families to report more frequently than every 12 months. Finally, to come into compliance, Minnesota must require legal non-licensed providers to take an annual health and safety training. This training will help ensure that providers are trained to safely serve Minnesota's children and families. This package does prioritize changes that are needed for Minnesota to come into compliance today and that are straightforward to implement, while also directly benefiting families. There is more to do to achieve full compliance, full federal compliance, and we have been in close conversations with our federal partners, as well as keeping abreast as to what other states are doing and thinking about, and we hope to continue this conversation with you in future sessions as we learn and plan more. Slide 8 is our operating adjustment. This proposal provides an increase to DCYF's base appropriation to maintain current services. This funding will help cover expected growth in employee compensation and insurance, IT services, and other operating costs. Additionally, DCYF has significant printing and mailing costs to provide notices to participants in programs such as SNAP. Finally, our agency maintains multiple eligibility and payment systems to deliver our programs such as food assistance, child care payments, and North Star foster care, adoptions, and kinship assistance. This operating adjustment will partially cover the rising costs of maintaining our IT infrastructure. Slide 9 is our transition account. This is a joint change item proposal for DCYF and Minnesota Management and Budget. This proposal reallocates one-time funding that was set aside for DCYF to transition to a new state agency through June 30th of 2025. This is not all the unspent money. $2.5 million would also be canceled to the general fund. Funding was used for the implementation office to successfully transfer staff and resources to the new agency, ensuring seamless operation for the people that we serve. Some funding remains, and our agency plans to use the funds to move IT and data infrastructure, to complete a risk assessment, to move out of rented space when our lease expires, and to develop a grant management system that can accommodate the programs from all of our originating agencies. The next slide shows our 2025 savings, of which we have two. The first on slide 11 is the Mille Lacs Band of Ojibwe. The Mille Lacs Band of Ojibwe received funding from the legislature to support their work in becoming an initiative tribe. During the planning process, the band identified a number of barriers to readiness and notified the department that they do not plan to pursue initiative status at this time. The agency will continue to work with the band to support their efforts if and when they choose to pursue initiative status. So funds at this time are now returned. Our second savings is in restorative practices. So as you may know, despite the roughly $600 million surplus in the coming biennium, the state faces a roughly $5 billion deficit in the 28-29 biennium. This is a serious challenge, and the governor's budget addresses this head-on. The governor and I recognize the Office of Restorative Practices as an important program, and these grants are funding pioneering work in this space that makes a real difference. And the governor is recommending several reductions in two programs given the current fiscal outlook for the state. This includes a $1.5 million cut in each year for the Restorative Practices Grant administered through the Office of Restorative Practices. This leaves a biennial base of $2 million in the program. Despite these reductions, there will still be ongoing funding for this program, which will allow this important work to continue, although on a smaller scale. The next few slides include 4 proposals that are budget neutral. Slide 14 is supporting relative foster care and permanency placements. This proposal expands public-private permanency collaboration, or PPPC, services to include permanency plans of transfer of permanent legal and physical custody to a relative, or TPLPC, or tribal equivalent. Currently, the commissioner is authorized to contract with private child-placing agencies and tribes via the PPPC to support county and tribal agency efforts towards adoption and customary adoption of children in foster care at no cost to county or tribal agencies. The same contracting authority is not available when a child's permanency plan is transfer of permanent legal and physical custody to a relative, or TPLPC, or an equivalent permanency disposition in tribal code. This not only excludes certain tribes from being able to access this free service, but it is not in line with statute and department policy supporting permanency with relatives, whether through adoption or TPLPC. This proposal expands PPPC contract authority to be inclusive of TPLPC or tribal code equivalent services to support permanency with relatives regardless of permanency disposition. Slide 15 is strengthening tribal child welfare supports. This proposal seeks to strengthen protections for Native American children and families by modifying certain requirements for Indian child welfare and special focus grants. Special focus grants are used for placement prevention and family reunification services for Indian children. These recommendations would remove the current cap per grantee of $100,000 on these grants, which would allow grantees to receive the amount of funding needed to make a significant impact in their communities. In addition, the recommendation includes modifications that allows tribes to determine the frequency of program reporting, allowing them to focus on program work. Slide 16 is Teach Higher Education Scholarship Updates. A policy of the National Teacher Education and Compensation Helps, or TEACH, Early Childhood Program was updated, requiring a state-level change to ensure our state's program is consistent with the national program's policies. This program includes changes to make additional individuals eligible for TEACH scholarships, allowing more flexibility in determining scholarship amounts, and reducing matching contributions, which are all budget neutral. Since the statute was enacted, the National TEACH program changed the maximum amount from a total maximum scholarship amount to a method that uses a maximum number of college credits. Because different institutions of higher education have a different fee structure, this policy change would provide flexibility and equity for providers attending different institutions. This proposal also allows family child care providers to participate in this program in a way that is equivalent to early educators working in other early care and education settings. This statute language currently refers to this provider type as self-employed scholarship recipients and requires a match amount of 20%. This is higher than all other types of scholarship recipients. The proposed change to the TEACH scholarship programs are aimed at providing flexibility and reducing barriers for the early childhood education workforce in Minnesota, particularly workforce members who struggle financially. And slide 17 is our Great Start Compensation Support Payment Program. This proposal makes two changes to the Great Start Compensation Support Payment Program. First, it establishes a special revenue fund. The Great Start Compensation Support Payment Program currently has carry-forward funds until expended under statute. A more common accounting practice is to place these funds into a special revenue account. This is a technical change. Second, it expands the 10% addition to monthly payments available for early care and learning programs located in an access equity areas to tribally licensed programs and programs that operate within tribal reservation land. State law provides that child care programs located in a child care access equity area are those that serve families receiving child care assistance or early learning scholarships are eligible for a 10% higher payment amount through the Great Start Compensation Support Payment Program. A child care access equity area is defined in statute as an area with low access to child care, high poverty rates, high unemployment rates, low home ownership rates, and a low-medium household income. Child care providers in access equity areas are more likely to be serving children and families who are facing higher barriers to opportunity. And that concludes our proposals today. Thank you for the opportunity to present, and I'm happy to take any questions.
Thank you, Commissioner. And we will have, I'm sure, some questions around the table and such, but I was just conversing here. You're asking a question. The actual official start of this new department is July 1 of this year, correct? And so everything that's kind of being before us it's a transitional period and getting ready for the startup?
Correct. Senator, and members, the department started on July 1st of 2024. We are in the middle of our transition, which ends on July 1st of 2025. So we have a few more programs to transition over to us, including programs from the Department of Public Safety and Office of Inspector General programs from Department of Human Services.
Thank you. We'll go to questions. Senator Port.
Thank you, Mr. Chair. Thank you, Commissioner. On slide 3, you talked through the funding streams to DCYF that are the federal funding streams, and it's $3.9 billion in 2026 and then up to $9.6 billion in 2027. How much of those funds are loans or grants that could be affected by the federal freeze?
Commissioner?
Thank you, Chair and members. Certainly, we have been looking really closely, given conditions of late. If I may, I'd like to ask our Chief Financial Officer to add.
Please go ahead and please identify yourself, and then you can join us.
Thanks. I'm Ashley Reisenauer. I'm the Chief Financial Officer for the Department of Children, Youth, and Families.
You know what, I would just ask you to be friendly to the mic because we're trying to keep the audio up, and we were trying to get it raised here a little bit ago, but it hasn't happened yet, so thanks for helping us.
Thanks. The federal funds in this governor's budget are a combination of the TANF fund as well as the Child Care Development Fund. We're continuing to, we don't know how the most recent memo and rescission will affect that, but we're continuing to work with Minnesota Management and Budget to monitor that situation.
Mr. Chair.
Senator Port.
Thank you, Mr. Chair. Thank you for that. On Tuesday, we were working with some of the housing agencies, and they received some pop-up notices and weren't able to access grant areas on the federal websites. The pop-ups cited federal funding withholding as the reason that they couldn't access it. Were any of the DCYF programs receiving similar notices or pop-ups or pauses?
We did monitor the federal grant portals that we use to draw down funds starting on Tuesday and continue to monitor them. One of the portals was frozen initially during the day but opened up throughout the day. Others, for example, the one that is used to process SNAP benefits was open and draws were continuing to happen both Tuesday and each day ongoing.
Thank you.
And I believe from what I've seen come out, it's been noted a few different times that things that affect human beings are not affected and weren't even proposed to be affected. It was other programs non-related to anything that I would think would be around our table if is that kind of the way you read it too? And of course, some of that's been pulled back. So at this point, it's kind of a non-issue, I would think.
We're continuing to analyze and understand what's impacted, what might be impacted in the future, and work with our federal partners and Minnesota Management and Budget and other agencies to understand what current impact or any potential future impacts are.
Thank you. Senator Port, anything else? Okay, thank you. Next up, Senator Gruenhagen.
Thank you, Mr. Chair. Yeah, thanks for your presentation. The on slide 5, it talks about enhancing program integrity. You're going to be working with the CCAP program, and I think you're probably aware of the Channel 5 investigation that's just showing a lot of problems and fraud and investigation into these. What is the current way of checking for fraud? Some of these daycares have dozens of violations. Do we go out and check on them? Do we withhold payment until something's corrected? It's interesting to me that a news reporter can come up with a lot of this information, and yet afterwards, I'm not sure what the state agencies are doing to prevent this. And this seems to be ongoing over the years. And we're talking about millions of dollars being sent to these centers. And is there any type of IT or checking done so that we can catch this early? And when violations happen to the degree that these published reports show, like the Minnesota Child Care Center in Minneapolis had 36 violations between 21 and 23. Do we do background checks? Do we withhold payment? Or what exactly is being done to try to minimize this versus it seems to be an ongoing problem? Commissioner?
Thank you, Senator and members. So certainly I'm aware of the news story that came out just recently, and am absolutely committed to looking more deeply into that and working with our partners at the Department of Human Services, Office of Inspector General. Am absolutely committed to rooting out fraud, waste, and abuse. That's a deep concern of ours in the agency. We have a number of compliance mechanisms that we are putting into place within the agency and that are ongoing. Part of the governor's budget and part of what I shared today is an electronic attendance record-keeping system. a 2019 report from the OLA did recommend for the CCAP program a statewide electronic record system as a tool to improve program integrity. And one of the reasons for that is paper records are obviously easy to falsify and can lack some credibility. So they cited that in the report. And so I think one of the ways to proactively monitor and attend to fraud is to move forward with this statewide electronic record-keeping system. I will say we do not yet quite have the Office of Inspector General in the Department of Children, Youth, and Families, but we are working really closely with our partners at Human Services and with the other state agencies to have more conversations about what this looks like. I think in order to have some proactive methods and to ensure that we are attending to this, we need to have some good conversations about the programs and also the licensing and Inspector General features that are currently in place.
Commissioner, before I'll get right back to you, Senator Gruenhagen, but you have referred to the electronic record keeping a number of times. What does that consist of? I mean, to me, it seems like it could be anything from just keeping track on a computer, or do they card in? I mean, this is to basically enhance to make sure that those children that we're paying for daycare services for are actually showing up. How does that work to kind of help clarify that?
Senator and members, I don't have the exact IT details and features of that, and I don't know if any of my team members could maybe come and speak to that. But the purpose is indeed to ensure that there is an electronic method that is less easy to game the system, if you will. Paper methods and are much easier to put in place. Oh, good. Someone can help me here. But I'll have Diane or Assistant Commissioner Halsey speak a little bit more clearly to this, if she may.
Okay, thank you. Welcome to our committee. Please identify yourself and help enlighten us.
Thank you, Chair Uckey. I am Diane Halsey, Assistant Commissioner of Early Childhood. Can you hear me okay?
Yeah.
To try to answer your question, talk a little bit about what currently happens. Right now, attendance is taken. We receive attendance information retroactively when people submit their reimbursements. So we don't have real-time information about attendance. When implementing the electronic attendance records, we will then be able to actually see on a more regular basis real-time information about attendance, which it will also make it difficult, for instance, to claim attendance in one program and not in another. So in layman's terms, it just makes it much more difficult to have fraud and abuse with the electronic attendance record system.
Thank you. With that, I'll go back to Senator Gruenhagen. Thanks for letting me jump in the middle here, because that was something I've been kind of wondering about.
Yeah, that's a good question, Mr. Chair. Yeah, I'll do one follow-up question. Okay, when you get violations of these daycare centers or the CCAP or whatever, do we withhold partial payment until it's corrected? Do we have a way of following up to see if it's corrected, or do we just keep sending the money out the back door?
Commissioner?
Senator and members, thank you for that question. So I can share that under current statute, the Office of Inspector General doesn't have the authority to stop payments because of health and safety regulatory violations. Payments can be stopped if providers submit false attendance records, operate after their license has been suspended or revoked, if they're accused of fraud. So there are a number of, key aspects to it, but I think there are a number of practices that should be dug into more deeply and some deeper conversations that should be had. And we'd be interested in having those conversations with you and others.
One more quick question.
Senator Gruenhagen.
Okay, has any daycare place had any payment stopped towards them in the last couple of years for any reason? that you mentioned there?
Commissioner?
Senator and members of the committee, this is something that I don't have information on, but our partners at the Office of Inspector General from DHS can certainly speak to that, so we can get that information for you.
Yeah, please, if you could find that out and get it back to us, we'd appreciate it. Senator Karen.
Thank you, Mr. Chair. Commissioner Brown, on the child care investigations, the Office of the Inspector General was created in DHS in 2011, I believe, for the same purpose as we're sitting here and having this conversation today. It's been the sole responsibility of DHS to provide that oversight, especially on the CCAP program, which appears to be pretty rampant fraud. The story last night was interesting, but not surprising. And what the story didn't include was, because of time, they could probably burn an hour on a news story based on what they found. Violations and 50, 60, 70 pages of violations on these programs, which are almost exclusively state funded. And so they chose to look at the top 10. That wasn't in the story. They chose to look at the top 10 CCAP daycare providers. Over a period of time, J. Cole's stops at morning, afternoon, and night. Doesn't find a single one accessible. Doesn't find a single activity at any of them, except for one that made the story, which he went back to, where the owner happened to show up. He asked her who she is, or she asked who he was, and she said she's the owner of a daycare, and asked how many kids you have. 80 of them. Most of these are placed in places that don't have parking, on-street parking, very difficult, right, in the city. So they ask, where are the kids? Well, they come at night. Now, that might be true for some, but can you tell me one daycare in this state that operates with 80 children overnight or in the evening?
Commissioner?
Thank you, Chair and members. So we do know that there are a number of childcare centers that have a variety of hours that operate. Some do begin in the afternoon, and some do operate overnight to accommodate families that work overnight shifts. And there aren't any specific requirements that childcare providers operate during specific hours. So I don't have a breakdown of the hours that childcare providers across the state do operate. But I appreciate the question. I certainly understand the concern that you're raising.
Mr. Chair, follow.
Senator Karen.
So, Commissioner, I've never seen, we've been doing this a long time. My wife runs a daycare. Those are challenges, but very few of those exist anywhere, more or less one that would serve 80 children. And in addition to, they only stopped at the top 10. Not a single activity, even in those centers, and pretty busy, going to shop in the morning, be pretty busy activity, dropping off 80 kids. We would see those things. But really, the story hasn't changed. We did the same thing in 2017 when we had brave whistleblowers come up and talk about the impediments of the ability for the agencies to do their jobs. I don't see anything changing. We know, I think many of us have people, good people on the inside who are telling us that systematically they are not being allowed to pursue adverse actions when these serious violations occur. I think one report says they're going to add 59 people. So what? It's been the agency's responsibility. You can talk about electronic records. Sounds good. But that was identified in 2017. The agency didn't need to be told how to put good business practices in. So we lean on the OLA again. I love the OLA, right? They do good things. I'm blessed to be on their commission. But we're talking the same story. And the other parts I have is when we look at the investigations or the annual reviews of those facilities, what hasn't been asked is, if somebody just randomly shows up to a daycare, which by the way, almost all are blacked out, no visibility inside, right? Which most businesses don't operate that way. And they showed up. So how do one of your inspectors gain access to a business that's inaccessible? And these businesses are getting millions of dollars, and the problem's been ongoing for 20 plus years. How are those reports able to get done? How are the investigation? Because some of them show that they physically must be inside because they're identifying hazards that exist. And yet, they're not accessible. So my fear is this is being perpetuated either through ineffectiveness, but willfully. Are we allowing or giving them 2 weeks' notice? Please, we're gonna be on the 3rd of January. So make it look like you're doing something. Because I just find it hard to believe that of those 10, I'm not sure how many were in there, but one had 80 children. Those are big daycare facilities, 100% funded with CCAP dollars. How is that possible? And then I ask, of the electronic records, we go to who's verifying. If you get no source of who they're verifying, so you'll get the record sooner, doesn't mean it's valid. Maybe you can stop some cross-pollination or making up names going from one daycare to another. But it doesn't change that. It doesn't absolve you of the job that you haven't been doing for 20 plus years. And this is really simple. All they had to do is send a reporter out there and say, anybody showing up today? Nothing more than that would have to happen. You know exactly how many sites or seats are licensed for or children they're licensed for. You know what their hours are, right? If it's a nighttime one, then I want you guys to show up. Not a single one has done that. We're in the same boat. I just don't know what's going to change. 2017 we had it. Now we're here in 2025. And it's taken another reporter to go out and just kind of show the work you're not doing. And I want clarity. How are the inspections being done when they're inaccessible? We're allowing this, and your agencies are complicit in allowing this. I know we got good people, but there's something drastically wrong. A new inspector general isn't going to help you, but you get the same rules that impede it. These millions of dollars that are going out should have been stopped. You need to act on the side of caution, and we're going to be far more gracious in saying, oh, you did the right thing. We're not even seeing an attempt. And it's really simple. We're not even talking about complex. Show up. And I know, and then I think what we have to do too is the counties are the ones doing a majority of the work in inspections. We need to know, because you're just a recipient of those reports, but then you have an obligation to act and to take conditions or take actions on those licenses. With the serious violations we have out there, we're punishing too many good people. You're forcing great people out of this industry by some that are being overregulated and actually forced out. And in this case, you're stealing money from thousands of people who need that support, and from not only the taxpayers, but we need those seats to be filled with legitimate, viable families with need. And I just don't see it anywhere. And here again, you want more money? Great. You want new electronic? You should have been doing it 20 years ago. The last time we did this, records, the agency let them make them up. They didn't even have attendance. Like, we'll get them to you in a couple weeks. Doesn't sound like anything's changed. That was 2017, when I think we're at the same table having the same conversation. So what's going to change? How are you going to make sure that people are prosecuted, that they're not diverted when larger crimes, organized crime, which we've seen tied in all of these DHS programs, what's actually going to change? That's what I really want to know.
Commissioner?
Members and committee members, thank you for the question, and I certainly understand the outrage, and I certainly understand the concern. We do think that broader authority is warranted here, and that we certainly need to investigate that more thoroughly to ensure that agencies do have as broad authority as possible to investigate fraud and act on all aspects of fraud. I don't know that is fully present. I do think that the limit on receiving public funds statute that has been passed does provide additional authority to allow us to go after bad actors and prevent agencies from allow agencies to stop actors from utilizing multiple programs, and that has changed, and that will continue to improve services. So I do think some improvements have been made, but I agree that additional improvements need to be made, and we're willing to be at the table and continue to see that this is an important thing that we need to work on and are completely committed to it.
Mr. Chair, we could go all day on this one. We want something done, and I want the agency to function, and it's not. And I'd be more than happy to walk side by side, but so far nobody's taken us up on the offer. What are you going to do differently with the workforce to get the job done? And we can talk all we want about adding people. We got to change our business practices in a significant manner. Mr. Chair, I'd like to circle back later on an IT question when others have opportunity.
Okay, thank you. Next, Senator Bolden.
Thank you, Mr. Chair. I have a comment and then 2 questions. The first, just sort of following up on this discussion. I think it's important to be clear about the terms we are using, and so in these conversations, fraud, waste, and abuse get kind of tossed around, but I want to be clear and specific that in the case of the story that has been referenced, it really was licensing that was the issue with that. And so, we have a system that doesn't necessarily delineate among types of licensing violations. There is a big difference between, something minor, having something a few inches, too close to something else, or having something, a bookcase in a back hallway, wrong place, versus something that is risking the health and safety of a child, which of course we should be taking very seriously. And so I know in the past there has been bipartisan support for looking at the licensing process and making sure that is a fair process. One that has a common sense to it. I hear a lot from providers in my district that it's a complicated, difficult system that doesn't always have that common sense piece to it. So I hope we can, in a bipartisan way, continue to have conversations about that licensing piece. And then I'm going to circle back my questions. I'm actually going to go back to the piece about federal funding that Senator Port mentioned, because I think it's important. While the memo was rescinded, the actual executive order was not. And so as we are building a budget, that is our role, I think it is really important that we have as good of understanding as we can in terms of what this is going to mean, because we are going to have to react to it. And so I'm wondering, when are the next funds from the federal government set to come into DCYF? What are they for? And as of right now, what is the certainty that you are going to receive them?
Commissioner? Or are we going to? Okay, Ms. Reisenauer?
Thanks, Chair. Senator, we draw funds on a variety of schedules from biweekly to quarterly, depending on our programs. We're continuing to monitor to be sure that those funds are being drawn on a regular basis and without barriers, but also continue to monitor changes at the federal level that might impact that, or additional guidance and work with our federal partners on that. So we don't know necessarily what the long-term impact is or what changes might be coming.
Senator Bolden?
Thank you, Mr. Chair. And I just have one follow-up question. I appreciate that. I mean, there are big questions. That's what we are hearing in many spaces, so I appreciate that. On slide 7, it mentions that the federal investment for our child care assistance program in fiscal year 26 and 27 is $13.6 million, and in 28-29 it's $20.1 million. So just as we don't know what's going to happen with that, I'm wondering what would happen if the federal government did decide to pause, or God forbid, completely withheld those funds. What would that look like? What would that mean? Who would be impacted? Is this for Head Start programming or others? Who would be affected? What might that look like?
Ms. Reisenauer, and am I pronouncing it right, Reisenauer?
Reisenauer, yes.
Oh, thank you.
Chair, so these funds are coming through 2 sources for this particular proposal, TANF and our Child Care Development Block Grant. We are, again, continuing to monitor. It's a source of funding that's important for the department for many programs and supports many programs. So I think we are continuing to analyze and understand what any changes at the federal level would mean at the state level for programs that we operate and other. And we'll certainly keep partners as informed as we have answers to. Thank you.
Thank you. Senator Bolden. Okay. Senator Wickland.
Thank you, Mr. Chair. I just wanted to make a couple comments about child care licensing and the CCAP program. And I think as stories come out that tend to blend all of the aspects of licensing and fraud and program integrity together, I think we need to be careful about what we're saying and what terms we use. Licensing actions can be taken Licensing actions were what was reported. There were visits to centers, and the licensor noted violations. When violations are reported by their licensing visit, centers and family child care providers have the opportunity to correct those. The result of violations can be correction orders or conditional licenses or removal of licenses. That is not the same thing as fraud. Providers have the opportunity to correct violations, and we need to modernize our licensing system so that the violations, they haven't been, the rules haven't been changed or updated for over 20 years. And we know providers want to be in compliance with rules, but if the rules are out of date, it makes it very difficult and challenging for providers to stay, in compliance. So that's something that is being worked on, and I hope that the licensing modernization project proceeds so that we can get to that point of updating and having clear and reasonable regulations. There's also a need to help providers understand, and parents and families understand, the difference between a low-level violation, that means adding some information to a form or correcting something that is not significant, from a more significant violation that does impact health and safety. And parents have access to some of that information today through the Parent Aware website. They can see what violations have been reported by the licensor, but it's really difficult for parents to tell, how significant are these. And some of these reports of many violations, we don't have context for, what the violations might have actually been and what the significance is. So at any rate, I think that all needs to be worked on in a way that supports the providers and supports parents having safe places for their children to go. In terms of childcare, the CCAP program, I have asked for information, and audits are happening, investigations are happening. Many changes were made after 2018 to set up different processes for investigators. They have an early and often program that helps new providers get up to speed with what their requirements are, and they have regular investigations as well as needed. So I think the early and often program that was established in 2019, and it provides a way to support new child care providers and includes extra education and technical assistance. And this is a way that we can help prevent fraud from occurring because providers will be better trained and understand the rules. They have more visits to providers when they're in that program, and as a result, DHS has seen a reduction in CCAP fraud and overpayments since they implemented the program. So if we want more data on what DHS has done since 2019, I think we can ask for that as part of requests that we can make. I know that part of the functionality is going to be moving into your responsibilities, Commissioner Brown. But until then, I think we need to get information from the right people and really examine what is in place in terms of program integrity and licensing, and make sure we're talking about things in an accurate way. So I guess I don't have a question, but that's my comment. Thanks.
Thank you. I don't know, do you have any comment back you want to make at this time, or we'll go on to the next question?
Well, thank you, chairs. I appreciate that, and also would echo, as you mentioned, some of those programs would certainly concur, and I don't want to speak on behalf of the DHS program, certainly don't have all of the information, so appreciate the call out for information to be shared from those partners. And also, want to also acknowledge that the CCAP program is a program that is currently with the Department of Children, Youth, and Families, and these programs are, of course, inextricably linked. So thank you very much.
Okay. Members, we've got, the next section is coming up, but we've got two more that we want to get to before we move on, but as soon as we can move to the next section, we will. Next up, we've got Senator Abler.
Well, thank you, Mr. Chair, and I've got 3 questions that will not be answered today, but I apologize for being late. I was trying to solve the e-bike problems and taxes, so I'd rather be here than taxes. So, this is an interesting, very challenging time. The people that we represent try to make it work in Minnesota, and most things they have to do are beyond their control, and so we come here to have a little bit of influence on the process. All the federal stuff is all beyond our control, and I don't share enthusiasm for all things that are going on there either, and just so there's a tremendous amount of angst and of things that are unknown, and we asked DHS yesterday if they could provide us with what they know to be true, so we can at least be aware of what is. And I mean, there's plenty to be afraid of, but until you know what is, then you just want to be afraid of the right amount of things. And so and I'm not a chair, and so I don't get all the little all the notifications, but at least if, to Ms. Brown and others, if you could tell us what you know on even a daily basis about what's going, because there's so much activity happening. If you could at least let the chairs know, and then they could all let us know what you know today. I don't even want you to tell me what you know today, because you kind of had the best you could know. But and so are individuals protected? That's what I've heard. I don't know. What's going to happen to these giant programs like SNAP? And I just would be shocked that SNAP goes away. I just can't imagine that. But people, oh no, what if? So if you could do that, I would be grateful. You don't have to reply, but just you're nodding. And so at least then I believe it's a day-by-day thing. And so here's today's update, here's tomorrow. I don't want to listen to the news and have somebody tell me. I'd like, really as a sort of an insider, to find that out from you. The second thing I'll just talk about the budget. And again, I think your budget is just, I'm trying to be kind talking to all you commissioners, but I believe this is aspirational. I don't see a path where a large amount of general fund is going to come to fund everything that you would like, particularly in an arena where many of the service providers are asked to live on much less than inflation, and in some case retrench. And not disparaging you for any of this, so I'm looking at your budget as what do you wish to be? And there's just as you already know, that the first line, the federal fund stuff, that may or may not be there, but I'm going to start asking every agency that I touch, if the money became flat, what if there was a freeze and the money that you were getting on June 30th was the same money you're getting on July 1st? What does that look like? Don't answer me now, but you can meet in my office and tell me. But I think watching how the system is unfolding here, I'm just a pragmatist. The House can't even decide to get together. I'm not even going to impugn guilt on either side. I think that they should figure it out and right soon. But they're not. Again, I have no control over that, nor do you. You just get to watch. And watching some of the dialogues that have gone on in some of the committees already, it's even hard to truly take someone other side's idea and incorporate it. I won't even give you specifics, but already 2 of those has popped up just yesterday. And so just trying to anticipate what the future might hold for us, and knowing that the hill we're going to climb to get this budget balanced is harder than 2011, because now we have to bring together the core of both sides. Anyway, so my question for you is, if the best we can ever agree to is let's just keep everything open, what does that look like? And finally, I do have a question I'll let you answer. And so is there anything, now that you have a new there could be some great merit in your new department. And one of the areas that we have lost ground on is in the licensed homes. Is there anything in your budget that's going to try to encourage the formation of more of those licensed homes instead of, as they've attrited mostly? But do you have anything in the budget or desire on your part to try to get more of those, particularly in greater Minnesota, but even in the metro? Thank you, Mr. Chair.
Commissioner?
Thank you, Chair and Senator. In terms of licensed homes, it is not something I don't think we have contemplated. I would love to chat with you more about what that might mean and what you're interested in.
Okay, well, and I'm trying to be brief, Mr. Chair, but I think, anyway, so we'll talk some more, but I'm not even, I'm in a pretty good mood today. I'm here to throw stones, but like there were some proposed rules that would have made it harder. So that doesn't draw more, it drives people away. And so, but is there some way, without even having money, through policy to make it, that the families, the people that are doing this can actually stand it to stay in the business and not just give it up, but also to draw more younger people in to want to do this. Many want to stay home with their kids, man or woman, and a great way to do that is to bring in, 6 or 8 other kids, and in terms of what we have for fees, how hard is it to set up, the inspections, is everything that they're inspecting necessary? And I mean, there was some discussion about how good the yard is any like bare dirt patches. I mean, and so just so you know, that kind of thing. And I think that in the middle of this crisis, we can find some ways to make some things work better, especially with a new focus. So, Mr. Chair, I'm done, and thank you.
Thank you, Senator Abler and Commissioner. The same information Senator Abler just asked for, I would like to have a conversation with you two at a later date, because I think that's very important to the areas we come from. But Senator Cran, did you say you had one? You're good for now? Okay. With that, anybody else? Nothing else? Okay. Thank you very much, Commissioner, and for your presentation, and the staff that joined you to help out here. We all appreciate that, and we'll move on to our next section, where we'll call up Ms. Sommerfeld, who's going to report on the income and resources for the foster care youth.
Mr. Chair, apologies, I have to get the right slideshow up.
Okay, no, not a problem. Don't we always love the first things that show up on our computer screens?
Apologies, I had this working before, obviously, so I have to see what it's showing. Apologies for the delay.
There we go.
My children will be so thrilled.
Technology is wonderful.
It is, yeah. Thank you, Mr. Chair, members of the committee. I'm Jennifer Sommerfeld. I am the Government Relations Director for the Department of Children, Youth, and Families. And I'm here today just to present briefly on the report recently created and produced through work with Management Analysis and Development at MMB by the department on preservation of benefits paid for children who are in foster care. So for context, the report focused on children and youth in foster care who are eligible for certain federal benefits administered by various federal agencies, such as Supplemental Security Income, or SSI, and other Social Security benefits administered by the Social Security Administration, including veterans benefits, railroad retirement benefits, retirement survivors and disability benefits, RSDI. Like foster care maintenance payments, federal benefits are paid on behalf of children, generally for covering the child's daily care and needs. And each federal benefit has separate requirements for eligibility. SSIS, for example, requires children to have an SSIS eligible disability or a medical condition and must meet income and asset requirements. Other federal benefits may be available for children based on their status as a dependent child of an eligible deceased parent, and there are no requirements or limitations regarding income and assets for those programs. Federal Social Security laws and rules allow representative payees to be appointed when in the best interest of the beneficiary, including when the beneficiary is a minor and is not able to manage their own funds. Representative payees are generally required for children under 18. They can be individuals or organizations. And the Social Security Administration has a preferred order for who should be appointed as a representative payee, starting with parents, then relatives, and then at the end of the list, social service agencies or custodial institutions. And I'll note that parents who are have children in foster care but who are working toward reunification are on that list of priority, representative payees above counties, states, and other government institutions. Parents working toward reunification with their child, when a child welfare agency is appointed as representative payee for a child in foster care, both federal and state law allow those funds to be used to pay for a child's foster care. And since 1980 in Minnesota, most counties or all counties have at some point used those benefits for foster care cost coverage. And for at least some counties, I'll note that these payments are not probably a significant source of funding, but they are extremely important to counties, given Minnesota's reliance on property taxes to pay for child welfare. Looking at a recent report from Child Trends, I'll note that of the states with county-administered child welfare systems, only 2 of the 7 with fully reported data use a lower proportion of state funds to pay for child protection activities. And those states are Ohio and North Carolina. In May of 2021, the Marshall Project and National Public Radio reported the state or local agencies in 49 states and Washington, D.C. collected and used federal cash benefits for eligible children and youth in out-of-home placement. The report touched off a national discussion on whether that was appropriate to use those funds and whether they should be instead preserved as assets for the children and youth in foster care. Across the country, youth currently or previously in foster care, their advocates and others began to ask for reforms that would require state and local governments to preserve those resources. And in some instances, there were lawsuits filed alleging unlawful receipt and use of federal benefits by state and local governments. Some states and local governments began working toward implementing programs to preserve federal benefits. And recently, the Federal Administration for Children and Families and the Social Security Administration have issued a request for comments from states, counties, the public, tribes related to the use of federal benefits for children in foster care. In Minnesota, this was elevated during the 2022 legislative session by foster advocates, an advocacy group where staff were instrumental in getting youth voices and perspectives heard around this issue and others at the Capitol. Their long advocacy led to the governor's budget in 2023, including a proposal to develop a plan and do the study and engagement work to look at how we could implement a path toward preservation of funds for youth. The agency contracted with Management Analysis and Development, as I said. They conducted extensive community and stakeholder engagement, reviewed and analyzed policies impacting this work, and then they collected and analyzed qualitative and quantitative data to be a base for the plan that we've included in the report that was submitted on January 15th. You'll be able to read this slide. I'll let you read it on your own, but this is a slide that shows the groups that we're engaged with. during the process by MAD to inform the plan. A few of the categories that we'll note are counties, tribes, people with lived experience, and community organizations working with families in the child welfare system. And then, as I mentioned at the beginning and just a minute ago, MAD handled this report, and they did the engagement efforts without our agency or any of our staff to ensure that folks who were speaking were able to feel comfortable that the agency wasn't there monitoring what they had to say. In general, there was support through that engagement for preserving federal benefits. This slide includes some common themes expressed to the staff from MAD during the process. Overall, many participants felt that preserving federal benefits while in foster care not only ensures that they're used to support children, but it also could help youth meet future needs when they transition out of care. As part of a plan, participants identified a need for youth to obtain federal literacy skills and to be made aware of the benefits that are available for them. And to mitigate risk, they suggested that implementation policies and practices be developed and standardized within the state. While there generally was support for preserving funds, there were also areas of risk and concern that were identified. For example, participants expressed concern that youth with preserved funds may be at risk of financial exploitation or funds may be misused. Additionally, there were concerns around the cost of implementing such a program and whether county agencies would have staffing capacity to manage accounts. When we were talking with other states, and I will say some of us on staff did participate in these discussions to understand policy, we learned that of the states that have implemented savings plan, they frequently commented that they wish that they had taken time to study the issue before they started implementing programs. And once they started implementing, they discovered that they had not thought about a number of important aspects of implementation. So just wanted to say thank you to the legislature and advocates for partnering on being able to do a deep dive into this issue. It's very complicated, and as we've worked through it, it's like the proverbial onion. Each time we would ask some questions, we would peel off a layer, and then there'd be a new layer of questions. So we did our best to work through as many as we could for this report. Aside from that, some of the more common themes that we heard from other states are included on the slide. For example, consider screening all children when they enter foster care for possible benefit eligibility. There was a suggestion that states consider being flexible with how we use the preserved funds to support a child's best interest, reunification, and permanency goals, and then youth needs upon aging out of foster care. Management analysis and development engaged county agencies in guided conversation as well as through fiscal data surveys. For the guided conversations, MAD received assistance from the Minnesota Association of County Social Service Administrators, or MACSSA, in obtaining contact information. And I'll note that 10 of the 11 MACSSA regions participated in those conversations. We really had great partnership with counties on this report. More detailed information is available, but a few of the considerations that came out of those conversations were counties' funding and staffing needs and ensuring that if these funds are no longer available and if there is additional work required by counties, that those funds are replaced and made up in a system that's already underfunded. It's really important that counties don't lose access to funds that they need to do their important work. And then I'll note that counties were divided on whether management of preserved funds should be the responsibility of the state or of the county. Of the 77 counties and county consortiums, 59 of them responded to the survey, and 77 out of 77, 100% responded to the fiscal survey. So again, really great participation, and we appreciate that. The policy survey requested information related to county policies and practices around use and management of federal benefits, while the fiscal survey asked for quantitative data and for state fiscal years 2018 to 2022. The surveys indicated that there are differences in practices across counties, and counties, based upon their own internal work, they consider various factors when deciding whether and at what point to apply for benefits, becoming the rep payee for a child. One statistic to note is that 76% of counties have, in some cases, left federal benefits in the home to support reunification and family preservation. Counties also reported considerable variability in terms of the number of children for whose federal benefits they served as representative payees, as well as the total funds received. Across the 5 state fiscal years, counties reported serving as rep payees for an average of 10 children per year, though the range was between 0 and 136. This amounts to a statewide average of 739 children or youth each year that are receiving federal cash benefits while in foster care. In terms of total funds received while serving as representative payees across the 5 state fiscal years, counties reported receiving a little over $55,000 each year, while the actual range averaged was between $13 and approximately $545,000. So it's a really big range in how much money each county receives from this program. Statewide, the average total received across the 5 state fiscal years was approximately $3.2 million per year. There's a wealth of detail and information available in the report, including valuable insights, perspectives, and subject matter expertise, more than what I can cover today in this presentation. So please feel free to read through the plan. It also highlights the complexity of this issue. DCYF used the considerations and other information provided by MAD to develop our plan, as was required in the legislation. However, as we worked through this, we found that there are areas where we still need elected policymakers to help us make decisions for a final plan if a program like this is implemented. So as I work through the plan, I'll just start by saying that we want to emphasize that all children and youth exiting foster care need support. These are children who are at great risk for homelessness, poverty, exploitation, sex trafficking, labor trafficking. We just want to note that if a preservation plan is implemented, there will still be a majority of children, the vast majority of children will leave foster care without the availability of cash savings. This doesn't mean we shouldn't preserve funds, it just means that as a state we have an obligation to look at all children. Our second recommendation is that federal cash benefits should be preserved and that the legislature should determine the program's scope, eligibility, and other critical components. More specifically, we recommend that county agencies manage the funds. They are the local agency or the agency that's closest to the youth. They are the folks that become the representative payees and are available to do that work. It would be complicated to create a new state bureaucracy where we transfer funds back and forth for a child's eligibility. We also suggest that funds be left in the home while reunification efforts are ongoing for some period of time so that the funds can support the family maintaining their housing and their ability to reunify with their child. As part of the recommendation, we also recommend the legislature consider which benefits should fall under the scope of the plan to make sure we're covering those that the legislature would like, the types of preservation accounts that should be available, such as a trust account, maybe for children who are receiving SSI, special needs trust, to ensure that they don't lose eligibility for other programs, maybe a high yield savings account for others, but those are complicated issues that put funds at risk for youth, and we didn't, as a social service agency, feel that we should be the final voice in that matter. We also think that should be a discussion of whether or not youth can access the funds while they're in foster care, and then what entity should be responsible for auditing a savings program. Based on participant feedback, including what other states suggested, we recommend that should the state put together a plan for preservation, that DHS would be or DCYF would be responsible for establishing and managing contracts with banking and other financial institutions. That way there would be consistency across counties as to what is used, consistency in interest rates paid and investments, and also any fees that might be charged. To ensure successful implementation, we recommend that the legislature determine the total funding that county agencies will need to replace lost funds and to hire staff. Other funding needs should be considered, such as program audit costs. And I'll note one of the reasons that this needs further discussion is there are some states, for example, Maryland, they apply savings plans to youth starting at age 14. So at age 14, they save approximately 50%, I believe, of those federal cash benefits, and then 50% remains with the state. And they increase that percentage before the child leaves foster care. So that saved money in how they put their program together. So looking at the cost, it's really going to depend on whether you're talking all children in foster care, at what point during their stay in foster care, and for how long those funds would exist. So there are a lot of considerations that need to be looked at. One of the issues highlighted through engagement with other states, as well as in conversations with financial institutions and county agencies, was how fees, taxes, and tax preparation costs would be managed. One particular state said, boy, we never thought about the fact that there might be investment fees, and now we don't know how to pay for those. So there's money invested in special needs trusts. There are fees. Did they come out of those accounts, or is the state or local agency? They were looking at all three of those options to pay for those. We recommend that they should be paid from a child's income and resources while the child is in foster care for fees, and that is consistent with other states that we've seen that, and general banking institutions' fiscal management processes. If the legislature chooses, though, as I mentioned, another option would be to appropriate funds to cover those costs for the youth, with the knowledge that if it's not a forecasted program, it will be difficult to ensure that all costs will be covered by state funding. Another issue that was highlighted was the potential negative impact of preserving funds for youth's continued eligibility for assistance programs. So as I mentioned before, SSI requires an asset limit and an income limit as well. So making sure that if there are going to be funds set aside for those youth, that they're in accounts that do not impact their eligibility, and provide some flexibility as well. We do recommend, and we would have been having conversations as well through our response to requests for information, that it would be helpful for the federal government, who has been looking at this issue and supportive of preserving funds, consider ways to help address SSI and programs like that for youth that are in foster care, to ensure that there are options for that particular population. Finally, we strongly recommend that the legislature consider impacts on tribes. There was some engagement that occurred during this report development, but I think more work needs to be done with each individual tribe, tribal leadership, and their social service agencies to make sure that they have the option to participate in a plan that works for their children. So more engagement and consultation is needed to understand their specific needs and goals. So what's next? In Commissioner Brown's letter accompanying the report, if you've not read it, she made it clear that supports are needed for all children and youth in foster care, as I mentioned. And I just want to close on a statement that was made at a recent Child Protection Task Force hearing by an advocate, and it was really powerful. I don't have the exact quote, so I'm going to paraphrase it. And what was said was that when the state chooses to remove a child or youth from their home with the promise that their lives will be better, the state has an obligation to make sure that that promise becomes a reality. And looking at these assets and trying to preserve assets for children's future is one of those steps that we can take a look at to help make that a reality. And then just a thank you slide, just to note, again, Foster Advocates was really instrumental in helping us both get the report together by helping us access youth with lived experience, and also bringing this issue to the attention of the legislature. The folks at Management Analysis and Development did a lot of work over the last 2 years, and we want to thank them. And then we really want to make sure we're thanking county and tribal social services. County has participated at a rate that was really high for us when it comes to surveys, and a lot of workers spent a lot of their work time working with us to provide information. Thank you.
All righty. Thank you. Members, questions or comments from Ms. Sommerfeld? The question I guess I'll start off with, will you be bringing forth any language that would be in line with what you've just presented to us? Is there a legislative action that you're wanting to see?
Thank you, Mr. Chair. We do not have legislation this year for this. This will be a costly program, and as noted, a lot of decisions still have to be made to guide what legislation would put in place, like age groups. So we are not in a position right now to say this should cover all children or this should cover children in this particular age group. We didn't make those recommendations, so I think a number of decisions would need to be made and conversations still had to narrow down what we would put into the scope of a bill.
Okay, thank you. Senator Bolden.
Thank you, Mr. Chair. Thank you for the presentation. throughout your presentation, many times you spoke to federal benefits, federal funding. I realize there is not clarity around what that will look like or is looking like, and so I'm not going to ask about specific dollar amounts or specifics, but do think it's important for us to have as much awareness as we can, given we are trying to put together a budget, and that will potentially affect it. So my question is, just sort of broadly speaking, and on slide 2, it talks about how federal benefits are used for children's daily care needs, et cetera. And again, it was mentioned throughout your presentation. Broadly speaking, if there are changes or withholding of any of those federal streams of funding, what would that look like for you, for families, for children? What might that mean?
Ms. Sommerfeld.
Thank you, Mr. Chair. Senator Bolden, I actually don't think I can answer that question right now. I'll need to spend some more time. We'll have to spend some more time looking at it to see if there would be an impact, and if so, what that would be.
Senator Bolden, okay, thank you. Senator Port? Nothing? Okay. Anybody else? Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, thanks for the presentation. You know, as far as the federal funds are concerned, according, again, we've just read articles, seen news reports so far. There's things to sort out. But basically, the article I read, the Trump administration just wants to make sure his executive orders are implemented on the federal funding. And the 3 items they listed in the article, Star Tribune: don't teach transgenderism to minor children, okay? Don't promote the Green New Deal, and don't promote DEI, the Marxist DEI. If you do those 3 things, you're going to get the federal money. Okay? Thanks.
Anyone else? Question that just in conversation it's come up, and you talked some about it, but the money that does come down from the federal government, Social Security benefits to the individual, but in some cases was captured by the counties and used to provide services without their approval. Have you been involved or in that? Is there any updates? Where do we stand? And kind of a solution to that particular issue? I guess, it sounds like that if the child, parent, guardian, whatever, said it was okay to apply to services, it's just fine, but there was some that they hadn't done that for us. Anything that you can share with us?
Certainly. Yeah, I just want to make it clear that state and federal law both allow counties to do this, and oftentimes it was encouraged because it was considered a way to reduce some of the additional federal money that would be needed to pay for foster care and state money that would be needed. So counties were following the law over the years when they've done this, and there was no requirement that they ask for permission. So I just want to be clear up front that legality piece there. There was a new legislation, or new law passed last year, gosh, time flies, last year, that requires notice from counties to youth in foster care who are receiving these funds that they will be used by the county as a representative payee. And I'm not sure of the status of implementation of that, but I can certainly get back to you.
Okay. Well, that's good to hear that we really don't have an issue looking back, and it's changed going forward. So that is good. Anything else around the table? If not, thank you very much for joining us here this morning.
Thank you.
Appreciate it. And next up, we do have comments from the Minnesota Association of County Social Service Administrators, and we've got 2 members to join us here this morning. Do we have 2, or is it? Or just, okay. Okay, it's got a longer title. I was taking that as 2 people. Well, you're covering for 2 people, right? But anyhow, welcome to our committee. This is Stacy Hennon, Executive Director of the Western Prairie Human Services and Director of Traverse County. So welcome to our committee. Please identify yourself for the record and go forward with your presentation.
Thank you. Good morning, Chair Oki, Chair Wickland, and members of the committee. Thank you for the opportunity to speak today regarding income and resources for children in youth and foster care report. My name is Stacy Hennon, and I serve as the executive director.
Stacy, can I get you to get a little closer to that mic because it's a little soft on the audio?
Sure, I can do that. I serve as the executive director for Western Prairie Human Services, which is Grant and Pope counties, and I'm the human services director for Traverse County, and the legislative lead for the Minnesota Association of County Social Services Directors or Administrators, or MACSSA, a statewide association of county-based human services leaders for Minnesota's 87 counties. I appreciate the opportunity to comment on this report as we work to provide the best possible outcomes for children in our care. On behalf of MACSSA, I'd like to express our gratitude to the Management Analysis Division for their thoughtful and comprehensive work as contained in the report and for the collaboration with foster advocates on this issue. We'd also like to thank Commissioner Brown and DCYF staff for their commitment to engage directly with our county workforce and represent the county role and consideration in this report. We are and will remain deeply committed to serving children, youth, and families to the best of our abilities through implementing services at the local level, all while in adherence to state and federal law and policy. This report lays out several areas for policymakers to provide direction. While we recognize the intent behind preserving the funds, we urge the legislature to carefully consider the significant financial impact such policies would impose on counties and the consideration of how this change may impact family preservation efforts and the complexities involved in implementation, including staff expertise. So the fiscal impact on counties, Minnesota operates under a state-supervised county administrative human services system, with counties bearing much of the financial responsibility for child welfare services, including foster care if state and federal investments aren't sufficient. The current practice of counties serving as representative payees allows benefits to be utilized to offset the cost of care for youth and foster placements. These funds are utilized to help maintain foster care infrastructure as they support room, board, medical, housing, clothing needs, and necessary services for that youth. By federal law, we cannot collect more than the cost of care for a child. According to the January 25 legislative report on income and resources for children in foster care, counties received an estimated total of $2.79 million in federal benefits in 2022 alone. These funds directly offset county expenses, preventing local tax increases, and ensuring that essential services to support the cost of care for a child remain intact. A decision to require counties to set aside these funds without state reimbursement would create an additional burden and unsustainable fiscal strain, necessitating increased levy rates or reductions in services elsewhere. There's also an interplay of federal benefits with family preservation efforts. We often, as you saw in the report, 76% of the time we allow families to retain these benefits under specific circumstances and evaluate requests on a case-by-case basis. The current system provides flexibility to support family reunification efforts, ensuring that when reunification is likely, benefits remain within the family to assist with stability. In many instances, these funds help cover expenses that help families meet their children's needs, reducing long-term foster care placements and improving family outcomes. Imposing a blanket policy that removes county discretion would limit our ability to tailor support to individual family circumstances. For instance, we often have families that struggle to make their house payments, to struggle to make their rent, and if we remove those funds, they would struggle to keep their housing, and that would make reunification harder. So we talk with those families, we make those decisions on an individual basis based on what's going to be easier to make sure that reunification is the primary goal, because that is always our primary goal when we remove children. There's also challenges in managing the funds for youth entering and exiting care quickly and the account administration. So another significant challenge for us would be the administrative difficulty in setting aside funds for youth who may be in care for only a short period. Many children and youth cycle in and out of foster care due to emergency placements, short-term stays, or court-ordered returns to family. The administrative burden of tracking, maintaining, and managing individual savings accounts for fluctuating caseloads would require substantial new infrastructure, including staffing and compliance monitoring, all of which would come at an additional cost. Furthermore, we ask the question, the question as to whether it is the county's role to become an account manager for the youth in question. Counties employ case managers and social workers to assist families and help in determining eligibility. We do not currently employ staff that have expertise in or support financial decision-making in accounting or banking management. There's also a risk to emancipated youth for other state benefits. So a critical concern that we have that must be considered is the potential risk to emancipated youth who may become ineligible for other essential state benefits, such as Supplemental Nutrition Assistance Program or SNAP, waivers, medical assistance, and other public assistance programs. Due to the preservation of federal cash benefits, if these programs count that money as income or assets, they may disqualify youth from receiving critical state-supported resources that provide food, housing, and basic needs assistance. This unintended consequence could leave some of the most vulnerable youth without the support they need to transition successfully into adulthood. Any policy changes should be carefully crafted to ensure that the preservation of funds does not inadvertently harm youth by restricting their access to essential safety net programs. The other thing that we've talked a lot about is the real need is the full support for emancipated youth and prevention services. So rather than focusing solely on preserving federal benefits, the legislature must address the broader issue. So ensuring full financial and social support for youth who emancipate from foster care, particularly those in the 18 to 21 age group. Minnesota should fully invest in extended foster care, housing assistance, education programs, and workforce training to provide these young adults with the tools they need to thrive as independent adults. A comprehensive approach to post-foster care support would be far more effective than simply preserving federal benefits without addressing the full scope of needs these youth face. We also heard from DCYF that it's about 5% of kids that we're talking about for these benefits, but we know that far more kids age out of care than that. So we want to look at a broader scope, not just that 5%. We strongly advocate for a comprehensive analysis of child welfare financing in the state of Minnesota to be conducted so that we may better understand the resources that support this foundation of care for our families. Without a strong grasp of the financial role that county, state, federal, and other resourcing plays in this issue, we will consistently struggle to make informed decisions and address root needs. Finally, we implore you as legislators to invest in prevention services so that families may be better supported in their communities, keeping children out of foster care whenever it is safe to do so. Investing in robust, community-based support can help families stay intact and provide children with stability in their homes, reducing the overall need for out-of-home placements. Prevention services such as family counseling, mental health support, substance use treatment, family and community resource centers, and financial assistance for struggling families should be prioritized to break cycles of family disruption and ensure that intervention happens before foster care placements become necessary. So in conclusion, we thank you so much for the opportunity to offer comment. In closing, we respectfully urge this body to consider the following. Provide full state funding to offset the loss of revenue to counties if this policy is implemented. Allow counties to continue case-by-case decision-making to ensure funds are used in the best interest of children and families and towards reunification when possible. Limit preservation requirements to permanent placements to avoid excessive administration burdens on counties for short-term stays. Explore alternative financial support mechanisms for all youth aging out of foster care rather than relying solely on individual preserved benefits. Ensure preserved benefits do not impact youth eligibility for other critical benefits such as SNAP and public assistance. Fully fund support programs for youth aged 18 to 21. Ensuring they receive housing, education, and employment assistance necessary for successful transition to adulthood. Fully fund prevention services to reduce foster care placements by providing families with the resources and interventions needed to keep children safely in their home. Counties remain committed to the well-being of children in foster care. As stewards of the system, we must ensure that policy changes do not create unintended financial crises or reduce our ability to serve all children in need. We appreciate the legislature's attention to these concerns and your willingness to dig into this complex and worthy issue. We welcome further discussion on sustainable solutions, and I thank you for your time and consideration. I'm happy to answer questions. Thank you.
Thank you. And first up, Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Ms. Hennon, for coming down and testifying in our committee today. And I was wondering if you could talk about, are there challenges that are perhaps unique or more acute for smaller counties, lower population counties? I know two of the counties that you work with are counties that I represent in the Minnesota Senate, and I believe, Traverse County probably has a population of a little over 3,000, Grant County a little over 6,000, and then at the other end of the spectrum, we look at Hennepin County that has more than 1.2 million Minnesotans living in it. And I was wondering if you could just talk maybe about some of those challenges or things that this committee should keep in mind as we're crafting policies that impact county human services departments. Thank you, Mr. Chair.
Ms. Hennon?
Thank you, Chair. Thank you, Senator. So there are difficulties, actually. When you look at the report in the back, it'll tell you counties and how much each county collected, and you look at Traverse and it says 0. One of the reasons that Traverse has not ever collected those benefits is because they've never had the staffing to do so. So Traverse County has 11 staff. They have 11 full-time staff. That's all they have. They have 3,000 people in their county. They don't have, their financial supervisor, their fiscal supervisor also supervises their income maintenance, their child support, and their office support. They don't have the capacity to do that. They don't have the capacity to go back and to collect RSI and SSI, let alone to now create all of these savings account, trust accounts. They don't have that capacity. So yeah, it's very concerning to me that we would have to teach our staff how to learn about investments and trusts and all those kinds of things that they would really struggle to learn the capacity of. A lot of small counties, fiscal departments consist of one person, if that, and that may not be all they do. They might do multiple things because they simply don't have the tax base to support multiple staff to do those things. So yes, I think that in small counties, the concern that we have is the task of doing this and setting up the accounts would be a significant administrative burden for us. So I think that when I looked at the report, and I obviously contributed to it when we did it, what didn't surprise me at all when I looked back and saw that Traverse had collected none, and we talked about it, and it was because we don't have the staff to do that.
Senator Rasmussen, anything else?
Thank you, Mr. Chair, and thank you, Ms. Hennon. I think that's really valuable for this committee to hear and just keep into mind as we're looking at policies across health and human services to ensure that if we want these policies to be implemented in lower population counties that have smaller budgets, that we actually give the counties the resources to do it. And I think this will be a topic that we'll continue to talk about as we're debating and looking at budgets. But one of the concerns that I have with the governor's budget and his proposal is a major cost shift of state human services spending to the counties. And if you look at, I believe, in not this next biennium, but the biennium after that, it adds up to more than $600 million that we'll be putting on counties, whether that's Hennepin County or Traverse County. And I think one of the unique things to understand about these lower population counties is that you could have one single human services case wipe out the entire human services budget for that county in a year. If you have someone who's in an intense program at direct care and treatment, that can just have a really big impact. And so I think as we're looking at both the policy perspective and the fiscal perspective, we need to keep into account how it's going to affect our lower population counties in Minnesota. So I appreciate you for bringing that perspective today. Thank you, Mr. Chair.
Thank you. Senator Port?
Thank you, Mr. Chair. Thank you, Ms. Henna. Through the Housing Committee, do a lot of work with the counties and social services, and I know how hard you all work and with so few resources. So thank you for coming with that presentation. Flipping back to the conversation about federal funds, I think we do know that there is specifically likely to be targets, though we don't know what those parameters will be, but for any programs that have anything to do with trans or non-binary children. There are certainly trans and non-binary children who receive social service funding through the counties, so we can expect that if this federal freeze moves forward, these programs would be targeted. I've spent some time with the counties in the last few days, and I'd first just like to read a quote from one of them, that operations would cease. Worse is knowing that the programs throughout the state rely on federal funding and the disastrous impact it would have on families. Children would literally go hungry. And I work in social services at the county level. People will suffer throughout Minnesota if this freeze is able to continue. Babies and children will go hungry. People with severe disabilities will be without care and services. Can you talk about like the day-to-day impact of, to county social services would be from this federal freeze, or if you've already experienced any of it in those first hours when some programs were cut off?
Ms. Hennon?
Thank you, Chair. Thank you, Senator. So I think we're still trying to understand the scope, but I can tell you that what we've received already are a lot of calls that express that exact fear from people who are concerned and who are afraid, people who are concerned that they won't, if their Medicaid isn't, if they can't get their prescriptions, they can't get their diabetic medication, they can't get their cancer medication, they can't get life-saving medication because their prescriptions won't go through, and they need those. And we have people who won't be able to get their child care. I mean, almost every stream of funding we have has federal funding tied to it. So I think that what the concern was for us is that there was not definition to it. There was not any kind of clarity to it. So we need to see what the clarity is, what comes forward. And, but yeah, I mean, I think for us, MACSSA has sat and we talked about this at our executive level, and we are trying to figure out how this will impact us. But certainly I think what people need to understand is that we really do provide services for the most vulnerable people in Minnesota. So if services are halted, we don't provide a lot of services that are not really mandatory and required, which means that there are safety net services, and people will suffer significantly if they don't receive those services. And we don't ask people when they come in for medical assistance if you're trans, or if we don't ask those questions, we just serve people. So yes, it will impact people, and I think that is the same thing my staff were concerned about, is if people don't get their emergency SNAP, or if people don't get SNAP, they will starve. They won't have enough money for food. That's a reality for people. So I think for us and for our staff and the people that we received many, many phone calls. We were inundated with phone calls yesterday. And so while I think it's easy at 100,000 feet to say, well, we don't know, we're not sure, we'll wait and see. At 50 feet, when we're getting calls from people who are crying and saying, what are we going to do? How are we going to get our medication? How are we going to get this? There's a lot of fear, because the services that we provide are genuinely safety net services. So we're waiting for clarity. We're trying to help people understand that at least right now there's been a freeze, and we're, I think he's pulled back some of it, but some of those orders will still stand. So we're trying to seek clarity and then get answers out to the people that we serve. But it's a difficult conversation.
Yeah.
Senator Port.
Thank you, Mr. Chair. Thank you, Ms. Henna. Obviously we don't have answers, but we are following it closely, and we'll stay in close contact with you and all the other counties as we figure out what the impact will be to Minnesotans. Thank you.
Senator Wickland.
Thank you, Mr. Chair. Thank you for your testimony, and just one quick thing, if there is a way that we could receive that electronically, I appreciate your testimony on the report, just to have the summary of your key points. Yeah, I really appreciate what you brought forward. It gives us a lot to think about. Also want to express my appreciation just for the report work in general, Ms. Sommerfeld and the agency, and all of those who were included in gathering the information. And I think from the report, you can really see just how complex an issue this relatively small issue is to bring a solution forward. And I appreciate that we have now all of this great information to help us make decisions. But it is going to be very difficult, because it does involve, finances, and we understand that the decisions we make do affect the ability of counties to be able to provide the services that they do. And I hope that we do go forward with more discussion as a legislature, but it is going to take a significant effort by the legislature to work on this. And for those who are directly affected, I think this issue of equity and, you know, knowing about resources and knowing what potentially they could do with them, you know, we need to keep the kids in mind as we think about what solution is best. I also think that through your statements and the commissioner's letter that's on here, just seeing that the majority of foster-involved kids are lacking resources to support successful transition. You know, that's something we really need to take to heart and think about as we do our budget planning. How are we going to be able to helpfully serve these youth who deserve our support as they move into adulthood? So this isn't really a question right now, but I just wanted to say thanks to you and thanks to all of those who contributed to the report. And I think there's a lot of work ahead for the legislature, and I hope that we can find people within the legislature who are willing to, you know, really dig in and start, you know, posing these questions so that we can make decisions on how we would move forward. So, thank you.
Thank you. Ms. Hannon, do you want any comment on that, or just take it as a comment?
We appreciate the
Receive a
opportunity to
good
be
comment,
here.
it's always good. Okay, Senator Liskey.
Thank you, Mr. Chair. Mr. Chair, Ms. Hennon. I'm going to start with a really easy question related to the common denominator of today is we've heard about the federal freeze on every presentation today. And I'm just going to ask you, have you seen or experienced anything at the exact moment where any funding has been frozen?
Ms.
No.
Hannon?
I'm sorry. No, we have not. I believe that has been stayed. No.
Okay.
Senator Liskey.
Thank you, Mr. Chair. Mr. Chair, based on everything I've read about the current executive order, the freeze, it's a pretty common thing. It's happened every 4 years when there's a change of the guard. They put freezes on funding on things that they don't want going forward. So from my understanding, this freeze is not affecting SNAP like we're worried about. It's not affecting Medicare like we've heard. It's not affecting Medicaid. The errors in the Social Security and the housing that occurred that Senator Port alluded to was an error in the computer program. It was not actually supposed to have gone forward on a freeze. Now, of course, we all know that errors happen. Whether that's a true error or not, I'll leave that up to everybody to judge on their own opinions. But the reality is those freezes are not supposed to have been in effect. And so until we actually know how this is going to affect things, we have to be more calm, and constantly putting fear out there into what might get taken away is not going to help. It's actually only hurting the public. So we got to be more patient and more understanding.
Okay. Any further? Oh, Senator Abler?
Thank you, Mr. Chair, and I'm just sorry I've been so in and out today. Some days are like that. So I just have a question that might have been covered. Is the department going to bring a proposal about this Social Security, trust funds or anything? Was that on their plan? Do you know?
At this point, no.
Okay. Can Ms. Sommerfeld come back then? Is that okay?
Sure. Senator Abler, you've got a question you want to?
Oh, yeah, so I
hear?
appreciate
Okay.
it. So actually, I was gone, but I actually looked over your presentation, I looked over the report, and I have a piece of legislation on this, which I can see is woefully inadequate to all the questions that you've asked. And forgive me if I repeat anything, but it's uncommon that the recipient of services actually winds up paying for those services. So I'm fully in favor of getting this to be squared away in a way that's thoughtful, and so that as these young people now become adults, I don't know when we have a youth is under 24, and I don't understand all these, whatever. So whenever they become of age and reasonably capable of, not just blowing all the money, I'm really interested to work on this, and maybe others are as well. But I think it's a thing that we should work it out. We don't want to hurt the counties, but I don't think it was your money in the first place, with all respect. So and I'll tell it to my county. But I know you all mean well, and there's a lot of pressures, so I'll just, maybe we can, whoever wants to help me sort this out, I think we should try to move on something. It looks like there's a lot of decisions to make, and I'm just telling you, I'm happy to work on that. And so there is a piece of legislation which we'll hear it sometime and go like, you need a few more pieces. So thank you, Mr. Chair, and thank you to both of you.
Thank you, Senator Abler. So you don't really have a question for Ms. Sommerfeld at this point. You just, or did you have something you want her to
thanks,
address?
Mr. Chair, I wanted her to nod on the record. So, but I didn't want to talk to her in the audience, but actually, well, Ms. Sommerfeld, I thought in the request there was something about you were going to bring forward a plan. And then you brought forward a lot of questions. So is there a reason you don't have something more specific as part of your agenda? I guess I'll ask that question.
Ms. Sommerfeld.
Mr. Chair, Senator Abler, as I mentioned during my testimony, everything we dug into on this revealed 10 more questions, right? And so a lot of we did put a plan in to the report, but we did acknowledge that there are a number of questions that would need to be answered that I don't know that we as a human services agency feel completely competent to answer, such as what type of investment should we be putting children's funds in? What level of risk should that face? Some of these things we really think that we need legislative buy-in on it and advice, because same as counties are not investment bankers, neither are we. So, but there are certain things that we think need to be decided. The cost would need to be decided based upon, I think, how much money is available and how the legislature would want to cover the program. Is this going to be for all children in foster care? Is it going to be for a certain subset of children in foster care receiving these benefits? Because different states have done it in different ways, the handful that have implemented this.
Right.
So we did our very best to come up with a clear plan, but we think there needs to be some further discussion on some issues.
Well, thanks. And
Senator Abler.
yeah, and so I don't know if this is a partisan thing, but if there's somebody, across the aisle, even not on this committee, that would like to work with me on this, I would like to address, at least put forward a template. I do have one more question. So, Ms. Sommerfeld, when they become age 18 and they're out of the system, or 24 or whenever they're done, do these monies then go to the individual?
Ms. Sommerfeld.
Mr. Chair, Senator Abler, I think that's one of those things that would have to be decided. And to a degree, it would be somewhat dependent too on where the funds are saved, right? So for
No, Ms. Sommerfeld, I didn't mean that. So just in
Okay.
current law. So now I'm of age, I'm done with there's no more foster services I'm getting, I'm on my own, I'm emancipated from whatever help the state's provided. And so now when does my mom's Social Security, my dad's Social Security payments come to me now, ongoing?
Ms. Sommerfeld.
Mr. Chair, Senator Abler, well, I am not a Social Security expert. I will just want to preface my comment with that, but Social Security payments through RSDI end when a child reaches age 18. Those are funds intended for a child's daily care while the child is in their minority. SSI funds, I believe, would continue if the child remains eligible for supplemental security income based upon their status. So I think that continues, but,
Okay.
and Ms. Hennon is nodding, so she'll help me with that. But yeah, and I don't know, I'll be honest with you, I don't know what happens with VA benefits. I suspect if they're based on their parents' death or disability, that they may be something that's for them while they're minors.
All right. Mr. Chair, and I'm not asking more questions, I'll just reveal more of my ignorance. But I think it's a thing that I think we would hope to address some way, and if you care about this, call my office, we'll sit down with the counties and you all, but I think it's something, I want to put a bill on it, so I'm going to see what we can do, and hopefully it can be a thoughtful thing where we address how to help these young people launch, which is, I think, what we all want. And maybe it turns out if we launch them well, then they're less of a cost, money-wise. But, we always talk about cost, but what about quality of life? You get them squared away, and away they go, and now they're, Anyway, thank you, Mr. Chair, and thank you to both of you.
Thank you. As long as I have you both at the table here yet, the first presentation had, when you talked about the extended foster care, I think it was a 5% figure. And Ms. Hennon, you said that number is actually far greater than that.
No, I said 5%.
And that, I was thinking the cost, you were thinking, was the cost was more, is that what I heard? You know, the extended foster care, the 18 to 21-year-olds?
Mr.
Ms.
Chair.
Sommerfeld?
Mr. Chair, members, I think that the difference is that I think Ms. Hennon spoke to a lower number of 2.7 million or something in that range.
2022.
Yeah, that was based on 1 year's data.
Yeah.
But our data shows that over the course of the fiscal years that we looked at, that the average was 3.2 million a year
Right.
in federal funds that were used by counties collectively.
We
Okay.
picked, Mr. Chair, we picked 1 year, 2022, so we just chose 1 year to talk about, but Ms. Sommerfeld did an average of all the years they looked at. That's
Okay.
why our fiscal numbers were different.
So you line up on that, great. All righty, well, thank you. Members, anything additional for either one of our testifiers? If not, thank you very much for joining us this morning. And with no other business before us, we will stand adjourned. Thank you.